Hi, my name is Tasha, and I'm going to be going over a skill video on prenatal education for a healthy pregnancy. To start off, I'm going to be explaining to my patient about appointments. Initially, you're going to go to your first month appointment. They will start at 4 weeks or whenever that you're going to find out, whenever you find out you're pregnant, and they do go up until about 28 weeks. Your second set is your bi-weekly appointments, which go from 28 weeks to 36 weeks. And then your weekly appointments, which go from 36 weeks until delivery. Your first appointment is quite in-depth. They're going over family history, your medical history, any previous pregnancies that you've had, any surgical histories, any medications that you've taken or take, and any risk factors. They're also going to give you your estimated due date. They're going to perform any vitals, take your blood pressure, which is very important in your pregnancy. They will take some blood from you and get your height and weight and have you provide a urine sample and do a urinalysis. They're going to be doing a pelvic exam, a pap smear, and an ultrasound. And depending on how far along you are, the ultrasound could either be transvaginal or abdominal. From then on, at every appointment, they will check your blood pressure and they will have you provide a urine sample and check your weight. Starting at 10 weeks, they'll use a fetal Doppler, and this is to listen for the baby's heartbeat, and they're also going to assess fundal height to make sure the baby's growing appropriately. At 20 weeks, they're going to do a fetal anatomy scan, and this is typically when you could find out your baby's gender. From 28 to 36 weeks, which are bi-weekly, they're going to do some routine checks and also have you do a Tdap vaccine, which is immunization. If you are Rh negative, you'll also receive the RhoGAM injection at 28 weeks. They're also going to have you do a 1-hour glucose tolerance test, and this is done at the lab. From about 36 weeks to delivery, they're going to continue to do routine checks and assess your baby's position, check your cervix. They're going to do a group B strep swab and educate you about any contractions, false labor, any warning signs, and of course what to do if your water breaks. Procedures throughout the pregnancy will include the initial and 20-week ultrasounds, any additional ultrasounds depending on your pregnancy. In your first trimester, they will do things like a urinalysis, a pap smear. In your second, you'll have the glucose challenge test, and in the third, the group B strep swab. Some of the labs that they're going to draw will include a CBC, a HCG, blood type, Rh factor, and HIV testing. There's also 5 genetic tests that you can opt into. 3 of these are blood tests. It's the NIPT and quad screen. Both are for Down syndrome, and AFP for neural tube defects. The other 2 are invasive ones, which is amniocentesis and CVS, which are for genetic abnormalities. Having a good diet is extremely important in your pregnancy as well. You want to increase your calorie intake by about 300 calories per day, depending on your pre-pregnancy weight. And you want to have a well-rounded diet, like vegetables for potassium and vitamin A, fruits for potassium, vitamin C and dairy for calcium, potassium, vitamin A and D, grains. You want iron, folic acid, and things like that, maybe proteins, beans, nuts, meats. And all your food needs to be fully cooked, and produce needs to be thoroughly washed. You want to have at least 8 to 10 glasses of water a day as well. Your prenatal vitamins are strongly encouraged. Some provide enough folic acid, but you probably need more. Some people do, some don't. They also recommend 600 micrograms daily to reduce the chance of neural tube defects. Omega-3 fatty acids help with brain development. Iron does help with preventing anemia, and calcium and vitamin D are important as well. For exercise, you want to stick to anything that's low impact, like walking or yoga, swimming, stretching, or Pilates. You want to avoid any like contact sports, any abdominal exercises, weightlifting, or anything that could cause falls. You want to do about 2.5 hours of exercises a week and do it over several days. Your weight gain should be based on your pre-pregnancy body mass index. If you're underweight, you want to gain about 28 to 40 pounds. If you're a normal weight, you want to gain about 25 to 35. If you're overweight, you want to gain about 15 to 25. If you're obese, about 11 to 20 pounds would be normal. A couple common complaints during pregnancy are Nausea, vomiting, so you want to eat small, frequent meals, keep snacks around, avoid any spicy foods, and ginger tablets. Stretch marks, you could use pregnancy-safe lotions, vitamin E, put oil on your stomach, abdomen area, sides, and thighs. Also constipation, so you want to increase your fluids, fiber, exercise regularly if needed. You can talk to your doctor about any stool softeners that you could take. A couple warning signs that require medical attention. If you notice any redness, swelling, pain, or heat in the leg, it could indicate deep vein thrombosis. Any persistent and severe headaches could be a sign of preeclampsia. Or if you're having any severe abdominal pain, it could be a sign of placental abruption. So you'll want to contact your medical provider immediately. All right, and this concludes my educational presentation for the day. Thank you.